Hello everyone. Thank you for tuning in to this month's episode of Pegasus. I am Dr. Brittany Moore Henderson, Community Outreach Veterinarian here at Mississippi State University's College of Veterinary Medicine. Joining me this month for this month's episode is Dr. Diana Eubanks, Clinical Professor here at the College of Veterinary Medicine. Thank you for joining me, Dr. Eubanks.
Well, thank you for having me.
So starting off, Dr. Eubanks, just to get to know you a little better, how long have you been here at the CVM?
I've been here 15 years.
Oh, wow. So 15 years. But prior to you coming back here, where were you?
I grew up in Metro Atlanta and went to the University of Georgia for vet school. Worked for a brief stint in South Carolina at a small animal practice, and then I moved back to my hometown of Smyrna, Georgia, and opened a small animal clinic, which I ran for approximately 10 years. I enjoyed clinical veterinary medicine very much, but I honestly kind of wanted to get out of the big city. And when I got to looking at places that I might like to come, Starkville was eventually top of that list, and I've landed at Mississippi State.
Okay, so you said that you had your own practice for about 10 years.
I did.
So what did you enjoy, really enjoy being in practice and being a practice owner, pretty much?
I did. It was a good thing for that point in my life. I was young, I had a lot of energy. Wanted to do something special, and it was an excellent learning opportunity. I feel like I kind of got midway through my career and wanted to do something a little bit different, and academia sort of called me, and I've enjoyed that change.
So what about academia that kind of drew you in?
I think after a certain period of time, you sometimes get where you really want to give back to the profession. I know it's kind of cliche to say this, but it's the students. I've enjoyed it very much, getting to know the students, getting to help them achieve their career goals. It's very gratifying to watch them.
It is.
You were one of my students, and it's hard to tell you this at this point, but you get to a point in your career that you probably worry less about what you do, but you're proud of what the generation behind you is doing.
Exactly. I have to say, I know I'm young in my career, but I have to say that teaching students here is very refreshing.
It is, isn't
it is.
Yeah.
Just knowing that you're making an impact on them.
That's right.
So that's amazing. So since you've been here, when you came back to Mississippi State, in what position were you in?
I originally was hired as an assistant clinical professor, and I was mainly doing research at the time, which was not anything that I had intended to do, or was not really what drew me here. But I did that for a few years, and then eventually drifted back to my first love of the clinical side of things. And one of the greatest things about a veterinary degree is there's just a diversity of things that you can do with it, and I think I'm kind of proof of that. I have sort of done a number of things with that degree.
Okay, so you pretty much was working in biomedical research, and how did you end up back into the clinical aspect of it? Like, what were you doing?
I think some of it's kind of just a draw. People tend to drift back to what they really love to do. I actually started I asked who was the director at that time of the animal hospital if they could use someone doing veterinary dentistry occasionally, and we sort of made my schedule so that I could come up and work in the clinics one day a week.
Okay.
And just
pretty much
over time things evolved. I was also teaching a little bit. They always need help in an anatomy lab, and I started working with first year students in anatomy. And that's probably one of my favorite parts of my job, is that I get to see the students during their first year, work with them, see them again third year in a very different capacity downstairs in the clinics as they start to put some of that book knowledge to work, and see some of their clinical skills develop. And it's really gratifying to be able to see them sort of from beginning to end.
Yeah, definitely. And so, but before we take a break, what was the reason that you chose veterinary medicine?
I don't remember ever wanting to be anything else. I know a lot of people say that, and I think there are people who are doing something different and then decide to become a veterinarian. There are people that look at all their options. I just remember from a very young age being one of those kids that was all I wanted to be.
Was a veterinarian.
And it's been a good good ride so far.
Definitely. So let's take a quick break and we'll be back with more in just a moment.
A baby's arrival can be one of the most exciting times in a family's life. It can also be one of the most anxious, especially if the child's development is hindered by medical challenges that create more questions than answers. At Mississippi State University, we're groundbreakers in the study of CHARGE syndrome, a genetic condition that leads to a host of life-threatening birth defects. Our research teams are uncovering breakthroughs in treatment and prevention with a goal of greater understanding that leads to better care. We're also providing crucial support resources for parents and helping physicians around the globe gain awareness so symptoms can be detected and addressed earlier. By engaging in this innovative analysis and therapy, we're not only improving outcomes, we're unlocking brighter futures.
Heard an echo down the well where my heart once hung. Hear my name ringing, ringing when I'm done. Hear my name ringing, hear it ringing. Hear my name ringing.
Flight. It's driven mankind's dreams for centuries. The ability to soar above the earth, to travel to faraway places, to connect distant points. Manned flights to the moon and space were once the stars for which we reached. Now, unmanned aircraft are the future. At Mississippi State University, our teams are developing unmatched unmanned aircraft systems for an array of critical applications. We're so good at it, the Federal Aviation Administration named MSU a Center of Excellence in the field, asking us to lead the team that's creating the operating regulations for unmanned aircraft systems worldwide. So essentially, we're writing the flight plan for an industry that is the future. Our work means better information, more opportunity, and limitless horizons for you. The sky really is the only limit.
Welcome back, everyone. Still joining me is Dr. Diana Eubanks, a clinical professor here at the College of Veterinary Medicine. So, Dr. Eubanks, so you are actually the service chief of our community veterinary service. How long have you been in that role?
I think about 6 years.
About 6 years. And so for people that don't know much about our community veterinary service, can you tell us a little bit about what all is done in this particular service?
Sure. We try to model ourselves after a general small animal practice. So many of our graduates go into small animal practice in a general private practice type of setting. And so we try to function very much like one of those. We focus on preventive type of medicine. A lot of the things that I always tell the students, these aren't the kind of things that end up on Animal Planet or cable TV, but they really are probably some of the most important aspects of general practice when they get out. And we, things like vaccinations, general wellness care, heartworm prevention, dentistry, that's an area that I have a special interest in. And just generally functioning very much like and we treat patients from the community and surrounding areas. We're able to tap into every other area of our hospital as needed.
Exactly. So that's what kind of makes our animal health center a little different. It's just the fact that we have our own little private practice, but if we need specialty,
that's right.
We have pretty much access to
a
them
lot of
anytime we need it. So that's kind of unique, and our students get the opportunity to see that how we are able to interact with those different specialty areas. So within our CVS area, our students get the opportunity to do some other unique things, such as work on their communication skills.
That's right.
For instance, so like one of the things that we have been working on is making sure that their communication skills are like they need to be by pretty much having our cameras in the rooms. Can you tell me a little bit about that? How does that somewhat benefit the student?
Sure. In many cases, this is the first opportunity for our students to meet one-on-one with pet owners. It sounds like it would be something that might be easy, but you tend to forget everything when you get in the exam room.
Exactly.
And so we try to coach them on techniques for asking history questions. Specific wording of questions can often get better information that can be usable about a pet's health status. The various other doctors on the rotation do a lot of work with the communications module portion of our rotation. The students are videotaped in the room. They know they're being videotaped, and then they receive very specific feedback about how they did.
Exactly, and it can be kind of daunting to them, knowing the fact that they're being filmed doing it, but they realize the impact that it has, the benefits of seeing themselves and actually being able to be critiqued and then improved by the end of the rotation. So I think it's very beneficial to have that.
It's just so important because they know so much and they've learned so much medical knowledge, but if they can't get out there and really interact with a client, it's going to be tough.
Exactly.
It's not going to go well.
Yeah, exactly. So, Dr. Eubanks, you're doing and pretty much handling all our dentistry. So, what was it about dentistry that made you decide that, oh, that's something that I want to do?
Well, I had done years of general practice, and I love just general small animal practice. I think as you get deeper into your career, sometimes you find a few things that you really like and want to sort of focus on. And the thing I like about dentistry is it's just a chance to do a lot of good for a lot of animals. I tend to consider it in the area of affordable preventive care, kind of like I said, like vaccinations and heartworm prevention and good nutrition. I think good oral care goes hand in hand with that. And so it's a way to prevent a lot of problems.
Exactly. What would be your advice or recommendations to our audience that have pets, and as far as making sure they're providing the best dental care? Because sometimes they don't think about dental care for animals.
Right. I would say two things would be very important. One, work with your veterinarian to have a regular oral exam. Some particular pets and particular breeds may be more prone to periodontal disease and dental fractures and things like that than others. So I can't really tell you a certain time frame of bring your pet in every 6 months or every year, but work with your veterinarian to make sure that you're getting regular exams. And the other thing is, don't forget about home care. You know, we do a lot of home care on our teeth. We don't just have our teeth taken care of when we go to the dentist. And there's various toys and brushes and dental treats and things like that. And again, your veterinarian can advise you on the ways to use those.
Okay, well, thank you so much, Dr. Eubanks, for joining me today.
Well, thank you, Brittany.
And I think that concludes our show. If you have any questions, comments, suggestions, please do not hesitate to contact me at brittany.henderson@msstate.edu. I look forward to hearing from you and seeing you next time here on Pegasus.